Hello, my name is Daniel Barraza. Today I'll be showing you how to measure body fat percentage using the 7-site skinfold measurements. The only equipment you'll need for these measurements are skinfold calipers. There are a couple keynotes to keep in mind before we take any measurements. All measurements should be taken on the right side of the body. Locate and mark all sites before the measurements. Hold calipers with right hand with the dial facing up, and record the skinfold measurement to the nearest 0.5 millimeters for 1 to 2 seconds. Record a minimum of 2 measurements at each site. It is important that you record measurements in rotational order to allow the skin to regain thickness. Calculate the average for each skinfold site. The 7 sites we'll be taking measurements at will include the triceps, subscapular, chest, mid-auxiliary, abdominal, superior iliac, and thigh. We'll begin with the triceps. To measure the triceps, we'll need to find the posterior midline of the upper arm. This will be halfway between the acromion and olecranon process. Pinch vertically and place jaws 1 centimeter above marking. Pinch the site for 1 to 2 seconds and release once measurement has been obtained. Next, we'll be measuring the subscapular. Have the client put their arm behind their back in order to measure the subscapular site. Locate the inferior angle of the scapula. Pinch diagonally at a 45-degree angle, and you'll be measuring 1 to 2 centimeters below the inferior angle of the scapula. Pinch site for 1 to 2 seconds and release once measurement has been obtained. Next, we'll be measuring the chest pectoral. This will be 1/2 the distance between the anterior axillary line and the nipple for men, and 1/3 of the distance between the anterior axillary line and the nipple for women. This will be a diagonal fold. Obtain the reading, then release after 1 to 2 seconds. The next measurement we'll be taking is the mid-auxiliary. Have the client hyperextend their arm. The mid-auxiliary line should be marked and leveled with the client's xiphoid process and the sternum. Pinch vertically and obtain the reading and release after 1 to 2 seconds. The next measurement we'll be taking is the abdominal. Pinch vertically 2 centimeters to the right of the umbilicus. Collect the reading, then release after 1 to 2 seconds. We'll now be measuring the superior iliac. The superior iliac is located at the client's hip bone or their iliac crest. Pinch and measure for 1 to 2 seconds. Obtain data, then release. The final site we'll be measuring will be the thigh. Have the client relax the right leg by shifting all their weight to the left leg. The site should be marked on the anterior midline of the thigh between the proximal border, the patella, and the inguinal crease. This will be a vertical fold. Pinch for 1 to 2 seconds and release after obtaining data.